We are going to bring up our next featured speaker, Dr. Faith Mitchell, who again is President and CEO of Grantmakers in Health. We thank her for her partnership and for her patience and for being with us.
Thank you, Olga, for that introduction. I see some friends in the audience. Thank you for the invitation to this meeting. It was really interesting to hear the Congresswoman because we have a board member who's from New Mexico, and I've had a chance to go there. I don't know if any of you've been there. You know, to be at a place where you can go 50 miles and there are no health providers, it really brings home what she was talking about. So I'm Faith Mitchell, as Olga said, President and CEO of Grantmakers in Health, which is what we call in the world of philanthropy an affinity group, which just means it's like an association of foundations with a shared interest. So in our case, we're about 35 years old, and it's foundations and corporate giving programs that have an interest in health. We're based here in Washington, but we work with folks all across the country. And I was invited to come and talk to you a little bit about what funders are doing related to Latino health equity. And I'm so really glad to have this opportunity. And to sort of start by telling you there's a lot of funder interest in Latino health, and it's an area of growing involvement. So first, I just want to give you a little background on what we do and the foundations we work with. So our role is to inform and advise the work of health foundations. We also provide them with strategic advice and technical assistance. So what we do is a lot of what we do is connecting them. Like I see Pat Matthews out there from the Northern Virginia Health Foundation. She's working on access issues in Northern Virginia. We might have somebody who's in Colorado who's also working on access, doesn't know Pat, but could actually learn something from what she's doing. And so GIH, a lot of what we do is we're like the connective tissue, and we do that with meetings and publications, webinars, and other kinds of activities, just connecting funders with each other. There are, as some of you may know, hundreds of health foundations in the United States. Many of them have a local or a state focus, and that's because of a process that's called conversion. So, for instance, the board member I mentioned who's in New Mexico is the Con Alma Foundation. Her foundation is the product of the sale of a health provider that served the state of New Mexico. It was a nonprofit provider. It was sold to a for-profit. The proceeds of the sale were used to create two foundations. That process is called conversion, and there was a big uptick of it in the late 80s and the 90s, and actually it's starting to happen again as an uptick because of the ACA. And so every time these sales occur, they create foundations that serve the same footprint as the original provider. So that's actually like the origin of Pat's Foundation, Northern Virginia Health Foundation. The Consumer Health Foundation here in Washington came out of the same process, Con Alma in New Mexico. So those sales going on all across the country have resulted in lots and lots of funders who serve local areas. It can be a city or counties or states. And so that's something for you to kind of keep in mind as you think about the philanthropic community. It's also something that really lends itself for the needs of populations like Latinos, because these funders are right there on the ground. They're working with local communities and local organizations, and they have a lot of incentives to sort of get engaged and understand local issues. There are national health funders as well, and those are the names that you're often most familiar with, like the Kellogg Foundation, Kresge Foundation, Robert Wood Johnson Foundation, which is, the sort of granddaddy of them all. In this country, Gates is the big granddaddy worldwide. Aetna Foundation, Commonwealth, Hartford, and so forth. So those are the foundations, the funders who can work all across the country. And that's another part of what GIH does, is to connect the national funders with local foundations. We encourage them to work together, just the way the representative was talking about Congress should work with local politicians. So I think all of you are familiar with this term of health disparities that a couple of speakers have already talked about. And I just want to review very quickly a slide that doesn't do justice to Latino health disparities, but we'll just, I'm going to go back for 1 second. So this graphic was just intended to kind of show you the foundations that we work with. And as you won't be surprised, there are a lot of them on the West Coast, in particular in California. So you've got that sort of bright yellow for the western states, but it's California, which has a lot of these conversion foundations that I'm talking about. A few private, but lots of ones that came out of health provider sales. And then there are a lot on the East Coast. So these are our funding partners, or members, as you would call them. And not every foundation in the United States is a funding partner of GIH, but I think our funding partners are kind of representative in terms of the distribution. The South has fewer foundations, and also the kind of upper Midwest, as I say, like Montana and North Dakota and South Dakota. But that just gives you a sense of kind of where the philanthropic resources are in the country. So this is, as I said, this is a graphic of Latino health disparities. As I said, it doesn't do justice because there are actually some more than are just on this particular graphic. But if the pale blue is the U.S. population as a whole, you can see dark blue, white, non-Hispanic, and then the color that kind of matches my top is the Hispanic Latino, that you have diabetes, just as the representative mentioned, obesity as two areas of particular concern, and not shown there is childhood diabetes, which is rising rapidly in the Latino population. And then we also know that access to health care services is a problem for many Latinos, either because of coverage issues, language barriers, immigration status, or sometimes a combination of those factors. Also not shown here is the fact that within the Latino population, there are also big differences in health. I worked on a project a few years ago at the National Research Council that dug into those numbers, and the numbers are not great, but hopefully they're getting better. But for instance, we know that Puerto Rican children have very high asthma rates and much higher than those of Mexican children. We know that Cubans as a whole tend to be healthier than, say, Puerto Ricans. So there are some big intra-group differences that these sort of blanket terms like Latino, Hispanic do injustice to, and perhaps some of you are doing research on some of those issues because those are important too. So as I said at the beginning, the good news is that many health funders are interested in doing something to reduce health disparities, whether it's for Latinos, African Americans, or Asians, and there are a lot of different approaches that they're taking to that issue. One of the approaches that a number of them are pursuing is the social determinants of health. And let me just ask how many people are familiar with that phrase? I won't just, good, big familiarity, great. And so you know, if you're familiar with the term, that we've learned from years of research that social and neighborhood and environmental factors have a lot to do with who gets sick. And it interests me that it's already been reflected in the two presentations today that people who work on health disparities sort of get the whole social determinants approach. I think, you know, it's more of a sell with people, some people who work in other areas. But I think if you know, the people who work on disparities, when you say like where you live makes a difference in your health, they kind of get it right away, and that the fact that it's not just kind of people's individual behavior. You may be familiar with this slide that Robert Wood Johnson Foundation produced a couple years ago, which is for this area, and they used it to kind of as one of their ways to kind of demonstrate how place is related to health, so that in the dark area, you know, down DC, you can see that the average lifespan is about 72 years, and then showing how with just taking Metro and going in different directions, that lifespan changes dramatically. And for you guys, that's not news. For some audiences, that's news. And so these patterns tell us that clearly something is going on that is more than just what people are doing individually. And so funders have really gotten interested in this topic, and some are limited in their ability to work on the social determinants because their focus is really health care, but others are able to work more broadly. And so what I want to do is kind of describe some of the projects that they have been funding. And actually, it was interesting to hear about Adelante, because I think it captures what many funders are trying to do, which is to support projects that have a health goal, but that also incorporate things like education and empowerment and working with youth. And one of the reasons, one of the reasons that funders are attracted to the social determinants of health work is that it enables them to work more, not only to address issues more broadly than just health care, but also that they can then work with broader communities than just the healthcare providing community. So it's a way of kind of stretching how they get involved. So here's some examples of some programs that use the social determinants of health approach. One of them is called Health Leads, and it's run by a woman named Rebecca Oney. I see somebody nodding, so you might be familiar with it. And Health Leads was founded by Harvard medical providers who realized that when patients and their families seek medical care, they often are having challenges in their lives at the same time. They might be having problems with food or employment or paying their bills, and so the program reflects that understanding that there are a lot of things going on in people's lives that affect their health. And so Health Leads encourages doctors and other providers to ask their patients about those other parts of their lives. Are you running out of food at the end of the month? Do you have heat in your home this winter? And then the Health Leads advocates, who are college students, are able to address those needs by actually filling prescriptions for those other things that people need. And so they work right there in the healthcare setting, and they work side by side with patients, and the effort is to connect them with these other resources that they need to be healthy. So there's one example of a program that's had some good early success, and it's continuing to expand around the country. Another example, which uses a different approach but kind of reflects that same social determinants understanding, is the Healthy Futures Fund of the Kresge Foundation. Kresge is based near Detroit, Michigan. Some of you may be old enough to remember Kresge stores. And this fund is a joint project of the Local Initiatives Support Corporation, which is a community development corporation, Morgan Stanley, the financing people, and the Kresge Foundation. And its goal is to support development of federally qualified health centers in underserved areas, as well as to provide affordable housing. So it's combining this untraditional funding with health and then housing for low-income people and families. What the fund does is it provides new capital for FQHCs. It also expands healthcare programs and tenant services that are available to tenants in affordable housing developments financed with low-income housing tax credits. And then it uses new markets the new markets tax credit structure to finance health centers in an effort to reduce transaction costs and leverage capital from investors. So it's an interesting example of a foundation trying to expand the resources that are available to it by working with, in this case, Morgan Stanley and LISC, and then also to combine housing and health. And Kresge, in fact, has a very strong interest in this sort of housing-health connection. So those are just a couple of examples I wanted to give you to show how the social determinants approach is expanding the range of what health funders are doing and opening up new possibilities for community partnerships. Now, I mentioned earlier that there's kind of broad interest in Latino health disparities among funders. And so what I want to kind of conclude with is a scan that I did of recent grant making, just to give you an idea of kind of comprehensively of the kinds of things that health funders are supporting. It becomes tricky because funders don't always break down their grant making in terms of specific racial or ethnic groups. So I'm going to give you some numbers in terms of the grants that I found, but I think they are underestimates of what's actually going on, because some funders would just put minority or health disparities, and they wouldn't necessarily say it's for Latinos, but in fact Latino populations could be included. So I found 22 grants for outreach, access to care, and coverage. And those grants for things like general outreach to make people aware of clinical services in their areas, or special outreach to educate people about the Affordable Care Act. There were 17 grants for prevention, so that addresses, as representatives said, that the funders get the need to support prevention. I think they are ahead of Congress there, and they're doing what they can in that area. So there were grants to reduce obesity, to reduce diabetes and HIV and so forth. 13 grants for community development, leadership, and advocacy, and I think Adelante would fall into that category. So this was supporting organizations involved in community development as it affects health and encouraging young people to advocate for health and things like that. There were 8 grants for workforce development and training. So these are things like pipeline programs to attract Latino youth into health professions, support for medical training, training nurses about specific issues. 8 grants for medical staff and service delivery. So those were directed to like clinic and hospital services. In many cases, that would be to improve cultural competency or translation services. And then 3 grants for research and data collection. This was things like data, collecting better data to improve service delivery. And I think this is an area, a lot of health foundations are more services oriented. But again, apropos what the representative said, there's a real need for advocacy in this area of Latino health and minority health generally, and data collection is an important part of that because you need the numbers in order to make the case. And what I have found is there are a number of foundations that got involved with data collection related to the ACA, but you can see that there's still some needs with racial and ethnic populations. So to summarize from that list that I gave you, the primary focus was direct services, prevention came in second, and then community development. And the community development grants in particular reflect this interest in the social determinants of health. My sense is that you will see increasing grant making related to community development, related to the social determinants of health in the future. I certainly hope that's the case, and that is what GIH as an organization is pushing when we talk to funders all across the country. So thanks for your attention, and good luck with the rest of the day.
You just stay for a minute and continue to the question or two? Great. So again, I want to thank both Congresswoman Luann Grisham and Dr. Mitchell for being champions for health equity in many very important ways. We do have a few minutes to take a question or two for Dr. Mitchell before we transition to our jurisdictional panel. Do we have any questions? We are happy to. About funders, yes?
Yeah, I guess one of the obvious questions perhaps the audience tried to ask is really more important. How do we connect with those funders who you go to your site and sort of reach out to individual folks about interests that we might have as organizations, locals here and national?
Okay, I have a trick answer. So GIH, even though we work with the funders, so the question was how to reach out to funders, how to find out who's interested in Latino health, whether it's, I guess, locally or in other parts of the country. And I was saying that, so at Grantmakers in Health, we work with the funders, but we actually don't, sadly, connect people with them directly. The good news is I used to be a grant maker back before the internet, and so I think it was like way harder to get access to foundations in those days. Now you can go to people's websites, and so you can sort of start with a Google search, like who's interested in funding these areas, and sort of see who, that's sort of the first step. I think working with funders is making sure that the funders you're approaching share your interests, and then you talk about what you're doing in light of their interests. And there's the Foundation Center, which has an office here in Washington, is a good place to start. They have a directory that you can subscribe to online. It's like $25 a month or something. We use it at GIH because they have a great database that just describes all grant making and all. You can just do searches on grant making and on funders' interests. Or you can go to the Foundation Center office. It's not far from here, and I think just use their databases free. But that's a good way to get your first cut on who is funding in this area. And then I think they probably have classes. If you've never written a proposal or a letter of intent, they have classes on how to do that. Some local funders do that. I don't know, Phyllis, I don't know if Consumer Health does that. We used to do it at San Francisco Foundation, like how to write a letter of intent, and how to write a good proposal.
I think some funders do it in different ways.
Mm-hmm.
And I think there are just a couple of things that are also important as you think about it is be clear on the kinds of things that you programmatically are really interested in
Yes.
as you do your search.
Yes.
So that you don't get trapped, as all of us have, in having the sources of money drive what it is you want to do. And then I just add and elaborate on what you said in terms of the importance of getting information about your program, work, outcomes, et cetera, out to people, independent of your request for funding, so that you begin to establish relationships, particularly in the context of a community, because this is a community. And GIH is tremendously helpful in trying to establish connections between local funders and national foundations, which is sometimes also a challenge. But I think that's a whole other
They asked me to summarize what you said, Phyllis.
Only so it could get on, because it was
Okay,
great,
okay.
just so we could on.
Well, Phyllis was saying, be sure, don't let the funding drive the proposal, but to be clear about what you're trying to do, right? And to do your searches based on that. So you're not, that's a trap that nonprofits can get into, is just, oh, well, so this foundation's interested in X, so we'll do X, and this one's interested in Y, and they can lose their sense of mission that way. And then the other main point I think Phyllis had was that it's also important just to network and get out so that people become familiar with who you are and what you're doing. That's what you were saying, Phyllis. And funders come to all kinds of local meetings. And so that's a chance to meet and hopefully sort of chat and find out more about their foundation and what they're interested in.
Terrific. Well, thank you again. This was
Thank
really
you.
phenomenal.
Thank you.
Thank you very much.